If you struggle with atrial fibrillation, high blood pressure, tachycardia, or an irregular heartbeat, then watch this video until the end to find some solutions beyond drugs or dietary changes for your heart conditions. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. When it comes to understanding heart rate, unfortunately, Western medicine often ignores the one organ that actually has direct impact on how fast or how slow the heart beats, and that's the brain. So the brain has a direct connection to the heart via what's called the vagus nerve. The vagus nerve is one of the biggest nerves in the entire body. It's Latin for wanderer, and the vagus nerve is one of the largest branches of what's called the parasympathetic nervous system. Parasympathetic nervous system is the relaxation or the healing part of your nervous system. It's responsible for slowing down your heart rate. It's responsible for breathing, digestion, and even for social engagement when we're out making friends and making new connections out in the community. It does all of that. And when it comes to things like a fast heart rate, atrial fibrillation, even high blood pressure, the vagus nerve is often overlooked when it comes to these conditions. So I'm going to tie in how the vagus nerve actually impacts these things and really how the heart functions when this nerve is not correctly communicating to it. So the heart has a natural rhythm to it. It has natural what are called pacemaker cells, which set the actual beat of the heart. And research has shown, and scientists have proven again and again, that if there is no direct neural control or brain control down to the heart's naturally going to start to beat faster and faster and faster. That's what it does because of these pacemaker cells. Now, the vagus nerve's main job is to act as a brake on the heart so that the heart can slow down in times when it needs to. Obviously, your heart rate's going to change throughout the day depending on the amount of stress that you're under. If you're in traffic, your heart rate should be much higher versus if you're sitting at home watching TV. The problem when it comes to addressing some of these conditions like high blood pressure, like tachycardia, like atrial fibrillation, or other heart conditions is that the brain's often ignored. So for example, if you're a person who has tachycardia, the typical route is going to be giving medications or something to slow down that heart rate. You're not going to look at how your brain is responding to stress, or more importantly, if your brain is stuck in a state of stress, which is going to cause an increase in that heart rate because the vagus nerve is not communicating to slow that heart rate down. Same thing with high blood pressure. Ask yourself, should my blood pressure be higher if I'm in a state of stress, i.e. I'm trying to escape a burning building, versus if I'm, again, sitting at home, relaxed, watching TV or having a conversation with a family member? Obviously, your blood pressure should be much lower in those second categories, and it should be much higher if you're trying to escape a burning building. However, if that vagus nerve is not communicating appropriately, then that's going to lead to an increase in blood pressure. Also, it's going to lead to an increase in that heart rate because the higher the blood pressure is, the faster the heart's going to be beating because it has to keep that whole system moving. There's always going to be a ramification to something happening. As blood pressure goes up, so does heart rate. And both are going to come down. As heart rate comes down, blood pressure is going to come down as well. Everything works in unison and in connection. So next time you think about, hey, why could I be having one of these issues? You need to understand and look at how the vagus nerve is going to have a big connection to this. Heart rate is one thing to consider when it comes to looking at heart function, but heart rhythm is something else entirely. So something like atrial fibrillation, or AFib for short, is a condition when the atria is now out of rhythm with the ventricles, or the top chambers of the heart are now out of rhythm with the lower chambers of the heart, thus causing problems in how the heart is functioning and how it's pumping out blood. The heart needs to have proper rhythm, much like two dance partners working in unison. Once it gets out of rhythm, that's when you start to have problems again with blood not being ejected fully, backups in the heart, and more problems are going to start to result. Again, one of the biggest leading indicators for somebody who's going to have atrial fibrillation is a problem with this vagus nerve connection to the heart, because again, that vagus nerve is going to be a direct connection into that atria, which is then going to have that slowing mechanism when it needs to on the heart. So the big question is, what can you do about these things if you're looking for an alternative to medicine and or dietary changes, and you want to see if there's natural solutions out there? Biggest thing that you need to do is you need to start looking at your function of your vagus nerve, and more importantly, how your overall nervous system is functioning when it comes to reacting to stress, but more importantly, how you're recovering from it. Most of us are really, really good at responding to stress, meaning that fire alarm goes off. we can respond to it and we can get out of the burning building. The problem comes is when we no longer in the burning building, but our brain still thinks that we are. And this is going to set off this entire cascade of constantly being on this in this fight or flight or survival mode, which again leads to all these other heart complications if you're stuck in that stress mode long enough. So the first thing you need to do is get your nervous system evaluated, find out really how you're functioning, and then getting under a proper course of care to be able to get this corrected. Second thing you need to be doing is really stimulating that vagus nerve to make sure you're really amping up that relaxation and healing part of your nervous system. Things like humming, gargling, and even deep belly breathing are very powerful tools to stimulate this vagus nerve and start to calm your nervous system down. Lastly, you can look for a doctor like ourselves. Reach out and schedule a consultation and or look for some information from us and see if there's something that we can do to support you. So on that note, you should be healthy by choice, not by chance, and for that reason, I will see you on the next video.